We're going over sciatic flossing. So this can be a potent move for people that are having, referred pain or radiculopathy or a nerve that's been kind of irritated. And when we do this, we're basically, if you think of the mechanics here, you have a sheath around the nerve, the surrounding tissue, and we want that nerve to be able to freely travel back and forth through those tissues. When maybe there's a nerve entrapment, well, we may have to work on those tissues and things that are entrapping the nerve and then floss it. Or maybe the nerve, became damaged, irritated or something from some, disc herniation or some sort of encroachment. And now we've kind of alleviated the issue and the nerve was swollen or is swollen, which is very common from a neuroinflammatory standpoint. And moving it can decrease pain, just like when you rub your head, the mechanical input helps with pain. But also it helps bring, anterior and retrograde nutrition to that nerve to help with some of the damage when we need to remyelinate from, what's called Wallerian degeneration when that nerve is compressed for too long. So how do we do it? So for a lot of people when they have low back pain, in particular if they have radiating pain, sitting's not fun, but in particular if we round the back, if we tuck the head, this is called a slump test, so we could test this out and be like, ooh, radiates. So we're gonna use a modification of that to stress and deload the nerve through the entire spinal cord through the sciatic nerve. So we want to start in a slightly flexed position. So the key here is we don't want to go to too much pain. So if you're already lit up, maybe we just start at neutral. But the first thing we want to do, and we're on an elevated surface so our feet aren't touching so we can move freely, we're going to get tall through our low back. So we're going to try to extend. Then we're going to, what we say, kick our chin to the ceiling. So as we extend the knee, pull the toes of the shin, we're going to look back as far as we can, and then we let the head come down around the back as we bring the heel back under. Again, tall through the low back, kick your chin to the ceiling, pull the toes of your chin, and back out. Now, in some cases, we may want to tension the sciatic nerve. So what would we do? We would extend, and we would just do the opposite, and we could even use that band if we wanted to, do a tensioner here. And it looks like a stretch, but we may need to build tolerance in those neurologic structures. Once they become very sensitive, we know there's not an entrapment and we've got the nerve moving. Now we can build some tolerance. So we could be flossing the nerve through the tissues or tensioning the nerve to get it to respond. We want to be careful with a lot of these and make sure that we're not creating pain or exacerbating issues and we do it in the correct sequence. So that's sciatic nerve flossing.